What is refractive surgery? Refractive surgery corrects eyesight imperfections. These imperfections are related to the anatomy and physiology of the eye that does not allow rays of light to correctly focus on the retina. Myopia or short sight is caused when the eye is longer than usual, or the cornea is more curved that does not allow the image to reach the retina. Short-sighted people can't see distant objects clearly. Hyperopia or farsight is caused when the eye is shorter than usual, or the cornea is less curved. The image is focused behind the retina, and vision is then blurred. Far-sighted people can't see near object clearly, also have difficulties to see far away. Astigmatism is caused due to asymmetrical cornea on different axes, which leads to two or more different focal points on the retina. Astigmatic people see a blurred image for near and far. Today, there are several solutions to correct these eyesight imperfections. Refractive surgery can offer you the possibility of vision enhancement without having to wear spectacles or contact lenses. Laser refractive surgery started in 1990 and have benefited from all technological developments on diagnostic systems, as well as developments in surgical techniques. This surgery is done under local anesthesia and lasts about 30 minutes. Before the operation, a complete checkup of the eye is compulsory. By using the slit lamp, your ophthalmologist checks your eye to rule out any clinical contraindications. The ophthalmologist will then determine the refraction of your eye, the same way as calculating spectacle power. A further examination with a Visson OCT will help your ophthalmologist to know the condition of the cornea and measure its thickness very precisely. This exam is simple and does not require any contact to the eyeball. With a CRS master, your ophthalmologist will get a topographic image, as well as a measure of the optical distortions of your eye. The measure of the optical distortions of your eye will indicate if there are effects on your night vision and your contrast sensitivity. The level of distortions will determine if a personalized treatment is necessary to optimize the quality of your vision and your contrast sensitivity. The topographic or aberrometry image will allow to have a personalized treatment via interconnection between CRS master and the Excimer laser MEL80. The surgeon will then give you a clear acknowledgement document that will authorize him to proceed with the surgery. To execute this surgery, two techniques are used today. The first one is called PRK. After giving anesthetic drops, the operation will be about taking out the epithelium of the cornea, then apply the treatment of the laser Excimer MEL 80 on the cornea. The treatment will then have modified the cornea curvature in order to allow rays of light to focus on the retina. You may have some discomfort for 48 hours. The visual recovery will be progressive and can take 1 to 2 weeks. The second technique, called LASIK, requires the use of a femtosecond laser VisuMax that will create the corneal flap. This VisuMax femtosecond laser is one of the most advanced technology which can perform a very regular and extremely precise cut with minimum clinical risk. The corneal flap will then be lifted to allow the application of the Excimer laser MEL 80 treatment. The same way, the MEL 80 Excimer laser modifies the corneal curvature for the rays of light to be focused on the retina. The surgeon replaces the corneal flap and verifies its positioning. The operation can be repeated on the second eye during the same surgery session. You may have some discomfort for 4 to 8 hours. The recovery of the visual acuity will be progressive and can take 24 to 48 hours. A post-surgery visit will be made to confirm the complete recovery and regeneration of the epithelium.